Okay, good morning and buenos dias, everyone. As I mentioned earlier today, my name is Patricia Tarango and I'm going to be your moderator for the day. It is my pleasure to introduce Laura Luna Bellucci, Bureau Chief for Women's and Children's Health with the Arizona Department of Health Services. With over 20 years of program development and implementation in maternal and child health, Laura brings her passion to this field while developing and providing guidance and leadership that strengthen systems and evidence-based strategies that help move the needle to improve maternal and infant health outcomes. Welcome, Laura.
Thank you, Patricia. Thank you so much for moderating our summit these next 2 days. Likewise, welcome to all of you to the 2023 Arizona Maternal and Infant Mortality Summit. We are so pleased that so many of you are joining us for our 4th annual summit. We have 551 people registered from around the state, and as you can see, individuals continue to join as we get our program started. While the topic of maternal and infant mortality is difficult, our annual reports and key findings keep us grounded in our work, allowing us to nurture existing and new partnerships and renew our commitment to addressing this critical issue. This annual summit creates a space where we come together to hear from experts, learn from one another, and support professional growth, identify opportunities to collectively improve maternal and infant health outcomes in Arizona. Understanding the connections between a mother's health and that of her newborn is crucial for addressing maternal and infant mortality and morbidity. As you will hear today, the majority of maternal and infant deaths that occur during pregnancy, childbirth, or in postpartum period are preventable, which is why it is so crucial that mothers and babies receive timely, high quality, and non-stigmatizing care during these critical periods. The Bureau of Women's and Children's Health and the Bureau of Assessment and Evaluation, along with the internal and external partners, are proud to bring this year's summit agenda that highlights policy opportunities, innovative action plans, evidence-based strategies that address maternal and infant health disparities, and a call to action. We begin this morning with our land acknowledgement. A call for acknowledgement and honor is a simple, powerful way of showing respect. It is a step towards correcting the stories and practices that erase Indigenous peoples' history, culture, and language. It is a move towards inviting and honoring the truth. Truth and acknowledgement are critical to building and mutual respect and connection across all barriers of heritage and difference. We begin this effort by acknowledging what has been buried by honoring the truth. Every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to make this history that led to this moment. Let us all take a moment to acknowledge the ancestral homelands of the tribes in Arizona. Today, I am speaking to you from the Phoenix area and would like to recognize the O'odham and Peeposh people who have stewarded this land since time immemorial. We pay respect to their elders, past and present. We are grateful and appreciative to those whose territory we reside and work on today. Now, I'd like to turn it over to Felicia Cocotzin Ruiz, who will provide our opening blessing. Felicia lives in the Phoenix metro area and is a curandera. A curandera is a traditional healer who carries knowledge of foods, herbs, and other cultural remedies working with the mind, body, and spirit. In curanderismo, it is believed that disease can be caused by psychological, physical, and spiritual factors, creating disharmony of the body, mind, and soul. Curanderas help bring people out of that disease state and back into harmony with various remedies and rituals. Felicia, thank you for being here with us today. Bienvenida.
Thank you and good morning, everyone. Kualitonali, Sengritamu, Buenos dias. Those are all of the languages that my ancestors have used to say good day. And good day from my office. Usually I like to give these types of openings outside, but it was still really muggy, so I decided to do it inside today. Like Patricia said, I am a curandera, and this year will mark, I believe, my 30th year of walking on this path of traditional healing. I was born and raised in Phoenix, Arizona. My family is indigenous to this land and to nearby lands. I identify as Chicana and Tewa. And I am following the path of my great grandmother, who was my first plant teacher, teaching me how to first wildcraft in northern New Mexico, where she lived and where all of my family would go back to every single summer. My mother was also learning from her and also from her mother. So a lot of people in my family, all women, we all have worked with maternal wellness for several generations. My sister is actually a traditional home birth midwife. And being that my business is called Kitchen Curandera, I work a lot with mothers, but primarily for their nutrition and for postpartum wellness. So I want to say thank you for allowing to share some words from the heart with you this morning, because this is something that is very important to me as well. To me personally, from my own experience of having a child over 24 years ago, and also seeing the people in my family also have and carry some of the hardships of being a brown woman and giving birth in this place of the Southwest. So I want to say that what I'm sharing with you today is really coming from right here. And in curanderismo, that really is part of the plática, the conversation. So I want to say thank you so much for allowing me to be part of your conversation. Thank you for allowing me to start the day and to wake up with you this morning. And so that said, I put together a few words because I wanted to know about the premise of today's summit, which really, I heard the words strengthen being said a lot. And so I want to really focus on that. And so I thought we could just begin today's summit with some words to first just settle in some gratitude and really just use whatever language is best for you. So some people might say creator, some people might use the word God or spirit, whatever feels good for you. It's just being thankful, and starting with gratitude is one of my absolute favorite things. And so I just want to start by saying thank you for allowing me to wake up this morning. Thank you for allowing me to wake up in this body. Thank you for my breath. Thank you for my journey. I'm thankful for the sunlight, and I'm thankful for the rain. I'm thankful for the sun and the moon. I'm thankful to my ancestors, and I'm thankful for my community. And I really want you to just think about who is your community, because for me, I have many people in my community, because I actually have several communities. I have my family community, I have my virtual community, I have my maternal wellness community, my healer community here in the Phoenix area. And so I want you to really think about who is your community, because if we're to strengthen that community, we really need to decide who is in that community. Once we share a vision, we're only going to be stronger if we can really create a tight weave. And it made me think of one of my rebosos, one of my shawls, is that when the weave is really tight, it's better for me to use when I'm using it as a birth worker. I'm using it to shelter myself from the wind. I'm using it for stretching. I'm using it to bind my belly. I'm using it to bind other people's bellies, their stomachs, after they have a baby. And so it's going to be stronger when we have a really tight weave. And so I wanted to just pose that question as we go into this summit for the next 2 days, to think about how we can strengthen our community so that we actually can achieve a vision that I believe many of us on this call today really want to see: better outcomes for all birthing people here in the state of Arizona. And so what I have is just a little reminder that we don't have to do this work alone. I often speak on topics such as this in other virtual communities, and I hear often that people feel like it's just a lot of work and they're doing it by themselves. And so this is simply a reminder that we're all here together to weave a stronger roboso, to weave a stronger community. And that said, I really wanted us to begin with just getting absolutely grounded with some focus to move into our summit. Part of my practice is I help people with PTSD and other types of I don't want to say like emotional distress, but anxiety and things like that. And I want to start with words that sometimes are helpful for getting grounded and just getting very clear on the vision and the focus. And so I put together a little morning, we'll call it guided meditation, guided words to find focus for the day ahead. And so on that note, I'm going to turn off my camera so that you actually can just be still and not be focusing on me and just be focusing on my words. So as I'm doing that, if you are able to, go ahead and maybe turn off some bright lights or maybe shut a door, just something so that you have a moment of stillness before we begin these next 2 days. Take a moment to welcome in your breath. Stretch your body. Open up your heart space and gently wake up if you're feeling tired. Sit comfortably in your chair, lengthening your spine, allowing the body to exhale the night. And when you get there, take a full belly breath and then exhale slowly through the mouth. If your eyes are not closed, gently do so now, taking a moment to welcome in this new day. Cultivating gratitude to be here and now. Feeling excited about the potential of this day and everything it may bring you, for all the possibilities that are being offered to you. Take a deep breath. Inhale with your most hopeful energy and breathe out any doubt you may be carrying. Scan your body to find any tension you may be holding on to, and use every exhale to find more softness. Let your breath melt away the tension from the top of your head down to your toes, softening the forehead, unclenching the jaw, relaxing your neck, dropping the shoulders away from the ears. Continue scanning your body to find any place where you may be holding stress, heaviness, or stuckness, and let it go. Keeping your eyes closed, let's start the day with focus. Let's begin with the feeling you would like to cultivate today. How do you want to feel today? Maybe you want to feel calm and peaceful, or maybe you want to feel energized and inspired. Bring this feeling to mind and observe where you feel it in your body. Take a moment to fully feel this feeling. Take it in, breathe it in, and then let it go for now. Now I want you to bring to mind 3 things you would like to accomplish by the end of this summit day. Ask yourself, what would be the most important? What will make the biggest difference? Perhaps it's to connect in a deliberate and more constructive way, to fuel collaboration, to deepen your understanding on a specific topic. Choose your main goal for today and state it out loud or in your mind. By the end of today, I will have. And check back with the feeling you want to cultivate. How can you get this intention done while honoring your intention of feeling peaceful or energized? Can you infuse this goal with the energy you want to cultivate today? Now let's become aware of the energy that is actually available to you today. Get curious, not only about the level of energy that you have this morning, but also the type of energy. Ask yourself, what is the level and type of energy that is available to me today? And notice how this may affect your intention for the day. Readjust if you need. Do you feel like you would like to go inwards and reflect? Or do you feel like brainstorming, dreaming, and imagining? Do you feel called to connect and share? Now I want you to bring back to mind your most important goal and the feeling you want to cultivate, as well as the energy that is available to you today. Bring your goal to mind and feel it in your body. Feel it in your heart. And then I want you to visualize yourself at the end of the day, putting the finishing touches on that goal. The last words, the last notes. Visualizing yourself closing the door to your office or your workspace, turning off the computer, feeling proud of yourself. You did it. You focused your energy on what matters, something that is important to you, and you got it done. Today, I encourage you not to fight with your mind, to bring back the feeling you want to cultivate should you feel distracted, really feeling it in your body. I hope this guided practice was helpful in finding focus for the day ahead. Thank you for sharing this time with me. Good morning, and have a beautiful rest of your day.
Gracias, Felicia. Thank you so much for the beautiful opening and for helping us to pause, give gratitude, and prepare us to receive the information and messages we will hear over the next few days. We appreciate you joining us and for the role that you play in the community, promoting mind, body, and spirit wellness. This year's theme is Systems and Communities, Creating Change for Better Outcomes. We will look at the strengths, gaps, and unique opportunities that exist within our systems of care and the important role the community plays here in Arizona as we continue to expand and diversify the birth workforce, engaging in our unique communities in an effort to continue to improve the maternal and health outcomes. Our objectives for the next 2 days are listed here on this slide, which are to describe systems level evidence-based strategies, discuss limitations and opportunities for growth and diversification of the Arizona birth workforce, identify opportunities for community engagement with tribal governments and grassroots organizations to support policy, systems, and environmental change aimed to improve maternal and health outcomes, and to learn about the Arizona Fetal Infant Mortality Action Plan and our call to action. Here's a brief glance at our agenda for today and tomorrow. As we kick off day one, our focus is on strengthening the birth workforce. This afternoon, we will hear about action plans and innovative approaches to address the diverse needs of women, birthing persons, and infants. And tomorrow, day two, we will focus on optimizing maternal and infant care. Next, I'd like to highlight some agency initiatives since our last summit. To start, I want to highlight the ongoing work and share the goals of the Arizona Maternal Mortality Action Plan. Many of you may be familiar with the plan that was launched in 2019. The Arizona Maternal Mortality Action Plan has been our roadmap on implementing numerous statewide and local initiatives, applying and being awarded federal grants to support this work, and has guided our planning for our maternal and infant mortality summits. The Arizona Maternal Mortality Action Plan has 5 goals. The data is indicating that our work is very much needed and that we need to continue to support and enhance the goals set in 2019. Collectively, we still have more work to do to meet our overall goal. You will hear later from our ADHS programs on the latest maternal and infant mortality data available. Thank you to our ADHS maternal health team, to internal and external partners that continue to drive the maternal health work forward in Arizona. I'm excited to share with you that tomorrow we will officially launch the Arizona Fetal Infant Mortality Action Plan. This plan is centered around 6 key goals, all of which align with our Maternal Mortality Action Plan. The Fetal Infant Mortality Action Plan, or FEMAP as we like to call it for short, aims to achieve the following goals: reduce prematurity, preterm births, prevent birth defects, strengthen systems of care for mothers and infants, diversify and strengthen the workforce, improve surveillance of fetal infant morbidities and deaths, and promote optimal fetal infant health. You will learn more about the FEMAP tomorrow and opportunities to get involved in the implementation of this plan. The Bureau of Women's and Children's Health, along with the Bureau of Assessment and Evaluation, coordinate and collaborate on a 5-year needs assessment as part of the Title V Maternal and Child Health Block Grant. In 2020, the 5-year needs assessment was completed, and after a review of findings, we wanted to take a deeper dive into understanding maternity care experiences of African American and rural women and birthing persons. In 2021, we partnered with the University of Arizona to complete this supplemental maternal health assessment, and the final report was published in September of 2022. You can see here that the assessment also identifies policy priorities, highlighting a topic that Arizona has already addressed, which is the expansion of public health insurance or Medicaid coverage for pregnant women and birthing persons up to 1 year postpartum, which is a significant milestone for Arizona. Please visit the Bureau website to access the report and learn more about the identified policy priorities to continue working towards our goals to improve maternal and infant health outcomes. I'm also excited to share with you that ADHS has begun accepting applications for doula certification this month. A little background on the doula program. During the 2021 legislative session, Arizona passed authorizing language for ADHS to establish a licensing program for doulas. This is a voluntary certification. The legislation also established the Doula Community Advisory Committee. The committee was composed of 9 doulas that represent diverse and underrepresented communities for a 2-year term. The advisory committee worked in partnership with ADHS licensing to address 3 main legislative tasks: develop a list of acceptable organizations that provide certification based on minimum qualifications and core competencies that were adopted in the program administrative rules, identify classes that address culturally relevant doula practices, and review rules and advise the ADHS director on any necessary updates. The administrative program rules were finalized and published in the spring of 2023 that describe the doula eligibility and scope of practice, application process, certification requirements, and fees. Licensing fees include a non-refundable application fee of $100 plus an initial fee of $200. The statute allows ADHS to waive fees for first-time applicants for individuals that meet the following criteria. Family income does not exceed 200% of the federal poverty level, or they are active military service members' spouses, or they are honorably discharged veterans who have been discharged not more than 2 years before the data of the application. The voluntary certification is for 3 years and must be updated every 3 years. Please visit the ADHS website for more information. As another example of how we are aiming to achieve the Maternal Mortality Action Plan was in fall 2021, ADHS partnered with the Postpartum Support International to train providers. In that time, 430 providers were trained in perinatal mood and anxiety disorders. 221 providers participated in advanced psychotherapy training, and 60 providers participated in the advanced psychopharmacology training. Arizona previously had 21 professionals that had perinatal mental health certification. After this partnership with Postpartum Support International, Arizona now has 82 professionals with a perinatal mental health certification. It's another great milestone for Arizona. We are proud to say that all of these providers came from 14 of Arizona's 15 counties and is a great example of how we are aiming to build provider capacity to improve access to maternal mental health care in our state. As many of you know, in 2022, HRSA launched the National Maternal Mental Health Hotline that provides 24/7 confidential support before, during, and after pregnancy in both English and Spanish, with interpretation services for over 60 languages. The next slides are to share with you a little bit about this National Maternal Mental Health Hotline. This slide provides a summary of the individuals who contacted the hotline. On the next slide, the pie chart on the left shows, the slide before, sorry about that, Dave. The pie chart on the left shows that majority of the calls, or 76% of the calls, were individuals calling for themselves, and 5% of the calls were from providers. The smaller pie chart shows on the right that individuals calling for themselves, 22% were pregnant, 41% were postpartum, 9% were a partner or caregiver seeking support and for themselves, and 28% were unable to determine the individuals calling. That number is listed down below, which is 1-833 TLC MAMA, which also translates to 1-833-852-6262. So the next slide is a summary of why people have contacted the National Maternal Mental Health Hotline, with the primary reasons included here. We have the top reason being depression and the lower end relationship conflict. These slides are a brief summary of the demand and the utilization of the National Maternal Mental Health Hotline. And tomorrow we will have presentations on how Arizona is responding to this issue. BWCH has been actively working in partnership with community stakeholders on multiple statewide initiatives to improve maternal infant health outcomes. The slide before you is a non-exhaustive list of a statewide and community-based strategies being implemented. We are grateful to our partners and staff for their tremendous work on these initiatives and the many others not listed here. And finally, I just want to encourage you to visit our Bureau of Women's and Children's Health website. Our website has information on ADHS programs, reports, and data that may be useful to reference as you apply for funding opportunities or prepare for your own assessments. The Summit website will include all of the presentations and will be recorded. The slides and the Summit agenda will also be there. If you have questions today or in the future related to maternal or infant health, please contact us through a special designated email, which is maternalhealth@azdhs.gov. We will make sure to connect you with the appropriate party or program. I want to thank the team and the staff at ADHS, the community partners, state and national agencies for their commitment and partnership to address and support this important work. I also want to thank each of you for joining us today and tomorrow. Your attendance and interest, your feedback will help us to continue to improve our efforts in improving maternal and infant health in Arizona.